In second-degree AV blocks, there is an occasional P wave that does not get conducted to the ventricles. This usually results in a long PR interval, but more telling is that some P waves are not followed by subsequent QRS complexes. There are two types of second-degree AV blocks, Type I, or Wenckebach, and Mobitz Type II second-degree AV blocks. Each differs in their anatomical causes and variations in PR intervals and dissociations between P waves and QRS complexes. Type I, or Wenckebach second-degree AV blocks are caused by an intermittent block of action potentials within the AV node, and eventually a complete failure to conduct an action potential from the atria to the ventricles. On a cardiac strip, you'll see a progressive lengthening of the PR interval until a normally occurring P wave is not followed by a QRS complex. You could think of this progressive lengthening PR interval as a warning, or a hint that this may be a Type I second-degree AV block. In Mobitz Type II second-degree AV block, the underlying disease is located with the His-Purkinje system. This block can occur below the AV node, within the bundle of His, or within the bundle branches. This is characterized by unpredictable failure of the His-Purkinje pathway to conduct the impulse from the atria to the ventricles. On a cardiac strip, in contrast to Type I second-degree AV blocks, there is no change in the PR interval prior to or after the non-conducted P wave. In other words, there's no warning sign, such as a gradually changing interval you see with a Type I second-degree AV block. In this case, QRS complexes are simply not conducted or dropped. As a result, Mobitz Type II has a higher risk of progression to complete heart block than Type I, and usually, when this is seen on an ECG, this would be an indication for a pacemaker, even if the person is asymptomatic. So in summary, with second-degree AV blocks, you'll see occasional P waves that are not followed by a QRS complex. In Type I second-degree AV blocks, you'll see a progressively lengthening PR interval before you see the missing or non-conducted QRS complex. In Type II second-degree AV blocks, you won't see any changes in the PR intervals. Instead, P waves appear normally along with their associated QRS complexes until a P wave is not fully conducted and a QRS complex is suddenly dropped. Of the two, Type II has a higher risk for progression to complete heart block.
Hope you liked our video. Share this information with your loved ones and don't forget to subscribe to our channel. Thank you.